Hello and welcome everyone. It's 9 a.m. My name is Amita. I'm co-founder of Nourish Doc. We offer preventive and holistic medicine that are backed by research, science, and successful. We present free webinars every Saturday morning at 9 a.m. Pacific Standard Time. Please note that this webinar is only for educational purpose. To present this, we have two very distinguished speakers today. Let me introduce Professor E. Sharma, who is, Professor E. Sharma has done a lot of clinical trials on diabetes as well as other ailments. He has thousands of people to manage diabetes success. Next, we have Dr. Gurudatta, who has over 20 years of experience as naturopathic doctor and yoga instructor. Dr. Datta offers yoga classes to manage diabetes. Please note that we have exhaustive information today from these speakers. So if you have a question during the webinar, please use chat functionality and we will take it as we go along because we want to make this as an interactive session. So with this, I will have Dr. Ish start.
Hi, good day friends. I am Professor Ish Sharma and we are here with a very relevant and very important topic, that is natural Ayurveda and yoga tips to manage your diabetes with the special reference to your immunity. Because it is COVID-19 times, it is never before disastrous time where immunity counts the most. And let's continue. I'll be covering a few topics, and those topics will be what is a virus, what is coronavirus, and what is COVID-19, an introduction to Ayurveda. I believe most of you who are here are well versed with Ayurveda, or at least are introduced to Ayurveda. That is why you are here. So I'll not be going to two basic principles. I'll just be brushing through them, and we move on to what is diabetes as per Ayurveda, what is immunity as per Ayurveda, what causes diabetes, and how can we prevent and treat diabetes, and how can we improve our immunity. These will be the subtopics. So let's start with the first topic. What is a virus and what is COVID-19? As you all very well know, the world is reading virus like anything. This is the most searched word on Google these days. Corona and virus and COVID-19. As you all could very well be aware by now, virus is neither living nor dead. And that is why we don't have any effective medicine from the Western medicine, which can be like genuine antiviral. We have got very genuine antibacterial medicines, antifungal are there, antiprotozoals are there, but we really do not have very potent, very short antiviral medicine. They, sometimes they work, sometimes they don't. That is why it is a pure grace of the virus, If that is fatal, then we have to surrender, like maybe polio or HIV or hepatitis or rabies. Or if the virus is milder, like some flu virus, which normally they don't kill, they are kinder, then we are fortunate. Now, are viruses of some utility or not? Like bacteria, we have got many very useful bacteria. Are viruses also of some utility to mankind or not? Yes. Before the discovery of antibiotics, viruses were the main antibiotic tool, because bacteria can be destroyed. Bacteria can be eaten by a special class of viruses called bacteriophage. So many bacteriophage viruses were developed to work as antibiotic. Later on, we had wonderful antibiotics, and that line stopped there. Secondly, viruses are very helpful in horizontal transfer of genes in our body. They are regularly transferring the genes, and that is how these have got two useful functions. And all other what they do are harmful only. Viruses have been with the human beings since inception, since the human beings evolved. Viruses have always been there, and coronaviruses are known since 1960. They did not change form much and that is why they were known by one name only, coronavirus. Now, for the first time, we had such a massive kind of a strain, such a transformation, where the new term was to be coined. That is what we know as coronavirus 2, which is an RNA kind of virus. Viruses can be RNA or DNA virus. You know very well. This is a RNA kind of virus, which is a small virus, like maybe 140 nanometer is the size, and this has got a very special feature. It causes a new disease known as COVID-19. This causes a very atypical viral pneumonia, primarily. What is viral pneumonia? Viral pneumonia will always be a dry kind of pneumonia where there will not be any productive cough. And these viruses are also believed to cause endothelial inflammation. That is why multiple organ failure can also ensue, which leads to lung failure, kidney failure, liver failure, and multiple organ failure, which can lead to death also. Now, when the virus enters our body, where does it go first? This goes to a class of cells which will be in receptors called ACE2 receptors, angiotensin converting enzyme 2 receptors, and those are abundant on almost every cell, and those are the most abundant on the alveolar cells of the lungs. That is why lungs are the most damaged. And when it comes to detection, then you have to know that from the day zero, when you just have the virus in, the most confirmatory test will be reverse transcription polymer chain reaction. RT-PCR is the most confirmatory test, which comes positive on day zero, to be staying positive normally up to day 20. This is taken from a nasal swab. And the other two tests which are used to tests, which are like the IgM, which turns positive on day 7 up to 21, and IgG, which as a rule turns on later, maybe from day 14 to day 28. These are the investigations, lab investigations. If the patient is having the lung damage, then it will be leading to lung fibrosis. So this leads to viral pneumonia with endothelial inflammation and lung fibrosis. That is where we finish with the introduction to virus, and we'll be moving on to introduction to Ayurveda and basic principles. Maybe we can take up some questions, Amita ji, if they are there. Come to Ayurveda. So maybe did Ayurveda, because we are talking about COVID-19 and diabetes and Ayurveda, did Ayurveda know about viruses? Yes, Ayurveda did not call them viruses, or Ayurveda did not call them bacteria. Ayurveda called them Sukshma Krimi and Bhoot. These were the terms used by Ayurveda to describe these invisible enemies. Ayurveda very clearly told there are some very small microbes which cannot be seen with the naked eyes. They are too small to be seen, and they are transferred upon physical contacts. When you talk, touch, eat together, hug, sleep together, when you walk together, that is how they transfer from one person to another and lead to many contagious kind of problems, many contagious diseases. And the first disease Sushruta told was conjunctivitis. Flu-like situations could be there from this kind of microbe transfer from person to person. That is where social distancing was very well advised by Sushruta, because you have to prevent the causative factors. You have to prevent this crowding. Social distancing is the first step to avoid these microbial spread. Such contagion can be only prevented through physical contact inhibition. Now we come to the basic principles of Ayurveda. We'll not be going into much detail, because basic principles form altogether a different subject and could be too long to be taken over here in detail. So Panch Mahabhuta is the first basic principle of Ayurveda, which is the Ayurveda anatomy. We can simplify in that language. Panch Mahabhuta are the 5 general elements. This is Ayurveda anatomy. Then those 5 Mahabhutas produce Tridosha, Vata, Pitta, Kapha, which is the physiology of the human body. And these all evolve from Triguna, Sattva, Raja, Tama, which is the mind quality. Sattva, Raja, Tama are the mind quality. What should we be doing? What is correct to do is determined by Sattva. How to do it is Raja. And when to stop, the controller is Tama. So all three are very important. Then we come to another very important basic principle of Ayurveda, that is Prakriti, your individual body type. Like your fingerprints, your body type is very individual. No two individuals are the same. And that is where Ayurveda physician will be routing through your Prakriti analysis, your constitution analysis. Will take an hour to make out what your Prakriti is. Are you a Vata type, a Pitta type, or Kapha type? We have got a questionnaire. We check your pulse, and that is how we reach to a conclusion. Accordingly, we make some suggestions to you, like what you should be eating, where are you more at risk to have some particular kind of diseases, what your diet habit should be, what your profession should be. That is what we can make from your Prakriti analysis. Then we have got a very strong forte from Ayurveda, that is preventive medicine. Your Tridosha balance, your Agni balance, seasonal and your daily routine, urges, natural urges, you should not be withholding natural urges. Meditation, yoga, exercise, these form very strong preventive medicine by Ayurveda, coupled with a few herbs which you should be taking every day as a rasayana so that you don't fall ill in first place. Then we have got a very special phytotherapeutics, that is healing herbs. What are the herbs that heal? What are the herbs that boost your immunity, or what are the herbs that control or regulate your blood sugar? That we'll be talking about. And then last, very powerful tool from Ayurveda is Panchkarma detox. How to use it to detox, how to use Panchkarma to boost your immunity, how to use Panchkarma to control or manage or prevent your diabetes. These are the basic principles which we'll not be detailing anymore. Maybe if we have got some questions coming up, Amitaji, we can take up. Now, very interestingly, Ayurveda is believed to be on a conservative side, maybe 2000 years old, and by other historians, this could be as old as 50,000 years. So it ranges between 2000 to 50,000 years old. And the modern science has been knowing diabetes for the last 800 years. Very interestingly, Ayurveda called diabetes as Madhumeha, and the modern medicine calls it diabetes mellitus. The words are ditto translation. They are word to word translation. Madhumeha translates to diabetes mellitus. So Ayurveda very well knew about diabetes, and it had a very scientific approach. Diabetes or Madhumeha part, Ayurveda has very clearly told Prameho Anushanginam, that is, the diabetes does not come to go away. It comes to stay with you. That is how it educates you to be very alert with diabetes, and you have to lead the life of a very disciplined person. You have to be very careful with the diabetes so that it doesn't harm you. It doesn't lead to very grave complications. So as I told you, Ayurveda has classified diabetes as type 1, which is Sahaj, that is you are born with it. It is a kind of a genetic disorder, or it can be Apatya Nimittish, that is it comes up as a lifestyle disorder or as an environmental disorder, which can more be linked to type 2. And Ayurveda very clearly told type 1 patients will always be underweight and of a young age, which matches so well with type 1 diabetes, which is insulin dependent. And the type 2 patients or Apatya Nimittish Madhumeha patients will be overweight and will be having more strength than type 1 diabetes. And type 1 has been told by Ayurveda, that is Sahaj Madhumeha was told to be incurable. No diabetes treatment was advised for type 1. It has been very, very clearly told all the prescriptions, all the treatments for diabetes Madhumeha are meant for type 2 only. That is what Ayurveda has very clearly told. And prior to 1921, before the discovery of insulin, type 1 diabetes was 100% fatal. It was just not manageable, just not curable, just not treatable. 1921 onwards, when insulin was discovered, that is where type 1 patients could find some treatment, and now they could survive also. So Ayurveda knew so well about diabetes. By diabetes, Ayurveda has coined a term Prameha, which are the metabolic disorders which present through urine. And the common symptom will be a lot of urination, a lot of micturition with turbidity. That is, voluminous and unclear kind of urine is the hallmark for all diabetes patients. So the symptoms Ayurveda mentions around 10,000 years ago are so well matching with the modern classification. That is where we can see the treatments could also be so much relevant. We have to explore more and more to find the relevance of Ayurveda treatments, which still are not available to all. We have to spread the word, and we can give an alternative to all the patients that they can manage their diabetes through Ayurveda. Now, what are the symptoms of diabetes or Madhumeha? The symptoms have been told by Ayurveda, which are so much matching. All the symptoms, causes, complications, everything matches very well with the modern description. The most important symptoms will be polyphagia. That is, patient will be feeling a lot hungry. He will be a lot thirsty. He'll be drinking water again and again. He will be passing a lot of urine. And nocturia, he might be or she might be getting up in the night to go to a loo to pass urine. This can be the first indicator that you could be having diabetes if you have to get up in the night and pass urine. So polyphagia, polyuria, polydipsia, along with weakness, are the presenting symptoms of type 2 diabetes. We'll not be discussing type 1 over here because we do not see many patients. Type 1 is altogether a different chapter. It is an autoimmune disorder which turns up overnight, which is very acute to come in, but we'll not be discussing that right now. The maximum patients we see are the type 2 patients, and which is very gradual to occur. And sometimes patient could be waiting for like 20 years and they do not know that they are suffering from type 2 diabetes. When they have got complications like diabetic retinopathy or diabetic nephropathy, that is when they come to know that, oh, they have been having diabetes for last 10 years or 20 years. So diabetes type 2 is very slow progressing disease. It all depends upon your sugar management. Will it be harming you or not? What are the complications? See, symptoms are not much bothering. If you are having polyphagia, polyuria, polydipsia, you can eat a lot, drink a lot of water and pass urine. The symptoms might not sound very bothering. What is bothering is the complication part. Diabetes will invariably be leading to blindness, renal failure, heart failure, nephropathy, neuropathy, and the retinopathy. These are the three commonest complications with the diabetic foot, gangrene, low immunity. Ayurveda has very clearly told that Madhumeha will be hampering your upper oja. Your immunity is bound to take a dip with Madhumeha. That is where you have to maintain your diabetes very well under control so that you maintain good immunity and you do not catch up with something like COVID-19. So after this introduction to diabetes, we go to what are the management principles. How do we manage diabetes or how do we manage Madhumeha? There are four things we route through: diet modification, lifestyle modification, some herbs, and Panchkarma detox. These are the four things we administer to all the clients. The most important are the diet modifications and lifestyle modifications. Herbs can be given, a few herbs can be given to control your diabetes and to boost your immunity. Panchkarma can be given for both the purposes, but diet modification and lifestyle modification are the most important. And that is where we have got with us Dr. Gurudatta, who will be demonstrating some yogasanas to us when I request him to come in. So let's take them up one by one. Maybe if anytime you have got a question, you might not be waiting till the end. You can anytime just stop me and put your question forward so that we settle it then there.
Sure. We are just at night one. We'll have to move along because Dr. Gurudatta has quite a bit of demo as well.
Right. Okay. So we move on to the four management aspects. What are the dietary modifications? The dietary modifications for a diabetic from Ayurveda are very unique. The patient should be taking small frequent meals. One should not be eating a lot at one time. He should be taking small frequent meals. The principle is Guru Aptarpana. He should be taking low calorie, high volume, complex carb diet. There have been many diet systems which have been tried, like a keto diet or a protein diet or pure carb diet. They all came and went away. They did not stay. They did not pass the test of time. So many diet approaches have been tried, but they did not succeed. The Ayurveda principles are very unique and they are very relevant. Guru Aptarpan, for taking low calorie, high volume diet, which will be comprising of like complex carbohydrates, bitter gourd, turmeric, black pepper, dry ginger, cinnamon, onions, garlic, a diet rich in all these. With these all have got proven scientific research papers as anti-diabetic. In USA only, there have been like thousands of papers with the efficacy of Ayurveda, and only cancer cure with ginger has been published under like 4,000 research papers in USA only. So all the world is exploring Ayurveda and we have to follow the principles. So the diet principles I review once again. Small free meals, low calorie diet, volume which should be comprising of complex carbohydrates. Simple carbs or sugars are a strict no. Then bitter gourd, turmeric, black pepper, dry ginger, cinnamon, onions, garlic are wonderful. That is your kitchen herbs or kitchen medicine, your kitchen pharmacy. You have to avoid overeating, chilled items from refrigerator, all the sugars, milk products and milk, alcohol and heavy meat. These are the things you should be avoiding. These will be depressing your metabolism and will lead to your uncontrolled blood sugar. Because diabetes from Ayurveda viewpoint is a metabolic disorder. That is why it is so much linked to obesity. Ayurveda links them very closely. Both come from Medo Dhatu, Madhumeha and Sthalya. Both are from Medo Dhatu. That is why both indicate fat metabolism abnormalities. That is where your diet will be a very important parameter. Now there are a few herbs which all have got proven scientific publications. There are thousands of publications for each herb. I'll be naming some of them. Charak has mentioned Amlaki and Haridra, that is gooseberry and turmeric as the best medicines for all the Prameha, all the 20 types of Prameha. So Amla or gooseberry, Indian gooseberry, then Kurkuma or turmeric, then Gugulu, Trikatu, Arjun, cinnamon, fenugreek, bitter gourd, onions and garlic, ginger and Gymnema sylvestra, Mahamajjak. These all are the herbs, single herbs which have got proven scientific value as wonderful pro-metabolic and hypoglycemic agents. So they really have got immense value and you have to combine them with your food and consume them as much as possible to keep your diabetes under control and to boost your immunity up. That is where we have formed a diabetic toolkit, So these herbs can be of immense use to you.
So maybe 1 second, Dr. Ish, you could explain, you have done clinical trial, as you said, and then maybe you can name which herb did you use for your clinical trial. I think that would be very useful for the users here.
Yeah. During my post-graduation, I had my first clinical trial with the diabetes mellitus, where 60 patients were taken and they were given a very special combination of 5 herbs, which were like a trifla, that is a Harad Baheda Amla, and two kind of Nisha, that is Haridra and Daru Haridra. These five herbs were taken from Yoga Ratnakar Grantha, and these were soaked overnight and given to patient in the morning, soaked in the morning, given to patient in the evening. These were given twice in the volumes of 100 ml. 60 patients were divided into 2 groups, and those were given Nisha Trifla Yoga and the others were given some placebo. And the results were really promising with the Nisha Trifla Yoga. It was difficult to take, being bitter, being 100 ml. Many patients reported that this was difficult to drink, but still it was very effective. That was my first clinical trial with diabetes. For my doctorate, for my PhD Ayurveda research trial, I again took another topic, which was metabolic syndrome. For the metabolic syndrome study, I selected 100 patients, divided them in 2 groups of 50 each, and those were given again Trifla, Daru Haridra, Devdaru, and Shankpushpi, Sarpagandha, and Shilajit, along with Medohar Gugul and Dashmula Kwatha. The patients are given medicine in 2 groups like this, and this was the first Ayurveda clinical trial upon metabolic syndrome. It was completed in the year I believe 2007. So that was the first clinical trial upon metabolic syndrome. And that is how these have been my very important clinical trials with the diabetes mellitus as a big study. Otherwise, we have been seeing patients every day. We are treating them every day. But the proper clinical studies were these two, Amitaji. Okay. Maybe I think we are not getting a connection from Amitaji. So maybe I move to the second component. We are done with the dietary modifications, and I will be waiting for your questions. Till then, I can move to the second part, where I will be, after some time, I will be inviting Dr. Gurudatta to take over. Lifestyle modifications. Lifestyle modifications are very, very important. Ayurveda has very clearly laid out what should be your dincharya, ritucharya. That is what should be your daily routine and what should be your seasonal adaptations. How you should be living a daily life, and what should be your seasonal adaptation, so that you switch over very efficiently and you do not catch up diseases. Among dincharya, it has been told that physical activity is very, very important. If you are stressed or if you are under some kind of depression or anxiety, then Ayurveda has very clearly told Vishado Rog Karanam. That is, being unhealthy at mind, being depressed or being dull or being under stress is very, very important, very big factor to invite diseases. That is where you have to remove your stress. You have to manage your urges, your physical urges, 13 physical urges, like you are hungry or you are sleepy or you feel like passing out urine or stool. You should never suppress your physical urges. With respect to diabetes mellitus, you should never be suppressing your urge to pass urine. For example, someone could be feeling like passing urine, but this as a lifestyle, we do not give much importance to it. Okay, I'm feeling like passing urine, but I'll be passing urine after 1 hour or later on when I'm free. This is not a second priority. You should never be withholding, you should never be suppressing your physical urges. This will be imbalancing your tridosha and will invite so many medical conditions. And the diabetic person should especially never be suppressing the urges to pass out urine and stool. You should never suppress them. Physical activity is very, very important, which will be burning your extra blood sugar. It will be utilizing your insulin very well. That is where a lot of cardio exercise, a lot of dynamic exercises will be very, very important to work against your diabetes. Yoga.
Thank you very much for attending this short educative webinar. And Dr. Ish has given a lot of inputs about what diabetes and what is the today's situation of COVID, and what is the sense of understanding from Ayurvedic perspective about diabetes. So that's a wonderful introduction. I'd like to share a few inputs or concepts according to yoga, what we are all about, what about diabetes, and how about how do we deal with diabetes through yoga perspective, yoga therapy. Before we do that, I need to share some important information about what a human being is all about according to yoga. In Taittiriya Upanishad, there is a concept called Panchkosha Concept. In this Panchkosha concept, the human being is considered as 5 different beings. As the picture indicates in front of you, we can see the different koshas or layers, that is starting from Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya and Anandamaya. As the name itself indicates, Annamaya Kosha is nothing but which is formed because of the food. Anna means the food, which nourishes us. We were single-celled organism when we were conceived in our mother's womb. But in course of time, with the nutrition, we grew up to 1 trillion cells or more than that, a big human being. So that was all possible only through the nourishment of the food. So that's why the physical body is considered, which is anatomically and physiologically perceivable. And also it is visible. It is very gross to see and feel it. So that's why it is called Annamaya Kosha. Next layer is little more subtler than the Annamaya Kosha, that is Pranamaya Kosha. Pranamaya kosha, even though it is not visible to our naked eyes, but it is quite feelable. We can feel the breath, we can feel the energy many times. We may not be aware of it, but we can feel energy as well. And today, energy medicine is taking such a big quantum step ahead that everything is nothing but energy. So, Pranamaya kosha is to do with energy body, which is subtle but has a control over Annamaya kosha as well, the physical body. The next layer is Manomaya kosha. Manomaya kosha is nothing but our emotions, our mind. Those are the things which deal with Manomaya kosha. I would like to bring in a concept here that according to yoga therapy, most of the non-communicable chronic conditions of today's world is starting from Manomaya kosha. Because any kinds of ups and downs in our emotions can lead to disturbances in Pranamaya kosha in terms of energies. And those energies, when they're disturbed for a long period of time, that can percolate to our physical body to cause physical manifestations. That's what yoga understands. And yogic tools also addresses all these three, including Annamaya kosha through asanas and physical postures, Pranamaya kosha through pranayamas, and for Manomaya kosha, we use yoga nidra and also relaxation techniques, meditation to bring a balance there. So when the next layer is little more subtler than Manomaya kosha, even though many times our Manomaya kosha overrules or rules our Vijnanamaya kosha, that is our wisdom. For example, as Dr. Ish mentioned, a diabetic is supposed to follow a strict regimen. He should understand to live with diabetes to prevent the complications. But we know that some of the mistakes, like we may not exercise, we may not eat the right food, and all that kind of stuff. Our mind wants to have those foods, but our wisdom tells that don't have it. But still, we overpower it and we succumb to our sensual attractions. So, Vijnanamaya kosha always guides us in the right direction. The last layer, which is the subtle most, is Anandamaya kosha. When all the previous four layers are in pretty much balance, we lead to what is the state called as complete bliss or happiness, which is Anandamaya kosha. When we are in that state, our physical body, the mind, the energy body is all in complete balance, and it is an experience which happens. We cannot make Anandamaya kosha through some practice. It has to be attained through the practices, through the previous layers. That is the basic concept of Panchakoshas in terms of yoga. Now, let us understand what are few in, important asanas which could be of great help in terms of diabetes and also to improve the immunity. When we do pranayamas, I'll come to that point as well. The first most important thing in terms of Annamaya kosha is a warm up. Always, I would recommend if somebody has been always doing any kind of physical postures or physical exercise on a regular basis, they can start off with yoga
which is compressed. Feel the stretch in my abdomen, and my breathing is very comfortable. I slowly come up breathing in and end it up by giving a forward stretch. In Shashankasana. A small point to be noted. Initially, anybody starting with yoga, they may find it a little difficult to do these postures. But when you have a consistent practice and regular practice, it becomes effortless. That is the definition of an asana as well. Stiram Sukham Asanam. For example, if I'm able to stand on my toes without any difficulty, stiram, stability, sukham, very comfortable, that itself is an asana. Even if I'm sitting comfortably without any effort, that is an asana. The whole practice of yoga asanas is to reach that state. That's the reason why we need so much of practice and consistent practice. So that was about a small demo about asanas. Amitaji, can we go to the next slide? Yeah, I'd like to go for the next demo about pranayama. Pranayama is concerned with pranamaya kosha, as you know, and in Ashtanga Yoga, it is the fourth step of Ashtanga Yoga. Pranayama, as the name itself indicates, prana is energy or breath, yama is regulation. Means to balance our breath is the idea behind pranayama. You can actually call it as energy rather than prana. Prana is not the exact translation of energy. Breath is not the exact translation of energy. Prana is energy. Breath is a language which we can understand. So first one, there are several pranayamas. The first one we generally focus upon is Kapalabhati. Kapalabhati is actually a bridge between asanas and pranayamas because there is a breath aspect and a physical aspect as well. But in pranayamas, mostly it is all breathing oriented and very less with the physical aspect. As I mentioned earlier, in pranayama, 70% is breath, 15% is body, 15% is mind. So that's the reason Kapalabhati is a bridge between asanas and pranayamas. Let me have a look, demo about Kapalabhati. Just have a look. As the name, I want to explain what is Kapalabhati. Kapala means our head. Bhati means to shine, to give a kind of, energy or expander energy, a glow to our system through the practice of Kapalabhati. That is what is all about Kapalabhati. And it is important for diabetes because one of the reasons of diabetes is also obesity and lethargy. Kapalabhati can be a great tool to overcome that lethargy. That's the reason it is important for us to understand this. In breathing, in a normal regular breathing, our inhalation is actually not passive. It is an active process. But our breathing out, exhalation, is a passive process. Means no energy is spent. But in Kapalabhati, we are going to reverse that. Forced exhalation and passive inhalation. Please make sure that you learn from a qualified and registered yoga therapist or yoga doctor with Kapalabhati, and also check with your doctor before you do it, so that if you have any heart conditions, you're not supposed to do this. So let me have a demo of that. We sit in a very comfortable posture, keeping our back erect. Our eyes are closed. Before starting, we breathe out completely. Now I take a deep breath in, and breathing out, start the Kapalabhati. You need to make a note what all happened in Kapalabhati. I was pressing my abdomen inwards with a push, physical push. That pushes my diaphragm. And also I try to exhale forcefully from my lungs and through my nostrils, very forcefully. With that, what happens is I'm trying to exhale as much as possible. And when I relax my abdomen out after one stroke, because of the negative pressure, air actually enters in and I'll be able to breathe out again. So same effect as other asanas as I mentioned, Kapalbhati also can be a great tool to help with diabetes. This is a small demo of the same. One more important thing, as we discussed earlier, is stress, which is a major factor for our non-communicable chronic disorders today. Yoga Nidra has been demonstrated through several scientific studies, and also I have seen a lot of patients who practice Yoga Nidra, to what extent the stress hormones and stress what they perceive, and managing that becomes very easy and very comfortable. So there has been a study also done we have the slide which mentions about the study as well. A group of patients, about 60 or 70 of them, they were divided into two groups, and one group was assigned for Yoga Nidra for about 3 months of practice, and the other group wasn't. So what happened was that the group which practiced Yoga Nidra had significant reduction in both fasting blood sugar and postprandial blood sugar. So that tells that how stress can have an effect in reducing our blood sugar if it is managed very well. And to give a simple example or a simple demo or explanation about Yoga Nidra, it has to be always done with an instruction. You will not be able to do without instructions because you may tend to sleep off, because the name itself mentions that Yoga Nidra, sleep, yogic sleep. In sleep, we are actually unconscious. We are not aware of ourselves. Yoga Nidra is a practice where we are in between being awake and sleeping, because you're aware of what you're doing, but get the effect of sleep, which is very rejuvenating, very welcoming and refreshing for us to take care of our life and the next day as well. So this will also help us to become very much aware. When the awareness increases, as Dr. Ish mentioned, we will be able to follow a routine.
Gurudatta, and maybe we can continue. I can continue with your such a valuable information. See, we all very well know that these asanas, which comprise like a very important factor from the Annamaya Kosha, these move such important organs in such a way, because normally the diaphragmatic organs are not much moved in a normal routine movement, like pancreas and liver and lungs, they normally do not move so well. That is where Kapalbhati comes in so handy. And all the three, forward bending and backward bending postures you showed us, Dr. Gurudatta, also work upon by a physical massage, a physical pressure difference to these organs, and that is how these become more activated. And if pancreas is more activated, surely diabetes will be much under control. So thank you very much for the informative demonstration. Now we move on with the topic. Stress has been a very important topic. Up to now we have already covered the dietary principles, and we are going on with the lifestyle modifications. In the dietary principles, as we discussed, that one very important mistake which is committed by most of the diabetic persons is overeating. Because they feel a lot hungry, polyphagia is a very common symptom, and they usually end up overeating. This is the biggest blunder they can commit. So they should not be anyhow surrendering to this lust, this urge of overeating. They should be controlling it very well with the nice tricks. There are so many tricks, and they should follow some degree of calorie restriction or intermittent fasting. Now we come to the stress part. Stress is believed to be directly linked to your hyperglycemic effect. If you are stressed out, you will be ending up having higher concentrations of glucagon in your blood and adrenaline in your blood, and both adrenaline and glucagon give you high blood sugar, and that is where your diet will not be well under control. Vyado Rog Karanam, as I already told you, Charak has very clearly told, if you are not healthy mentally, you are bound to invite so many medical conditions. And what do these stress hormones do? We'll be taking up in the forthcoming session. Meditation will be a very important phenomenon to de-stress you. How do you meditate? With some hobby, with some family, friends, or you go for a classical meditation with some guru or with some music or mantra? How do you meditate is totally your very personal kind of approach. But any form of meditation is bound to neutralize a very big percentage of your stress hormones. That is where you have to practice meditation, if possible, every day. Now we come to another component of treatment, that is Panchakarma.
Dr. Ish,
Yes,
we
Amita.
have only 3 minutes left. I think we need to wrap up and give some time for the questions. So,
Okay.
yes.
Okay. I'll not be detailing Panchkarma. Then Panchkarma is a detox kind of procedure, which is very unique to Ayurveda, and we keep on accumulating a lot of toxins. It could be diabetes or it could be any disease, because we do not purify this body very well. We are using, and we do not purify. That is where toxin buildup takes place, and that presents as many medical conditions. So periodic detoxification is very important. I will not be detailing it right now. We move on to concept of immunity. Ayurveda has very clearly told that we can manage our immunity in a yuktikrit manner. That is, a planned immunity management can be there with the diet and lifestyle, de-stressing and exercise. Stress is believed to be directly linked to your immunity. It has been found if you are stressed out, you are under the effect of stress hormones, your immunity will go down. If you exercise regularly, your WBC count, your cytokines, and all your health parameters, your hemoglobin is bound to improve with physical exercise. So less and less of stress and very genuine and mild physical exercise, maybe half an hour every day. If you are not exercising and you want to exercise like 3 hours in one go once a week, that will not help you. You have to be doing it very small portion every day, maybe half an hour every day is the secret. Doing a lot of weightlifting, doing a lot of static exercises will not help you. You have to resort to dynamic exercises, very small incremental and daily exercises, which surely will improve your immunity.